Julie Lichtenberg, M.A., R.N., is the Director of Educational Services and Service Excellence at Provena St. Joseph's Hospital in Elgin, Illinois, within the Chicago suburbs. Julie holds a BA in Leadership and Management from Judson University and a Master's in Training and Development from Roosevelt University from Chicago, Illinois. Julie is an executive registered nurse with over 25 years leadership experience with service excellence, clinical education, and neonatal intensive care nursing. Her enthusiastic, innovative style and high-energy spirit motivates and inspires others to lead more effectively. Ladies and gentlemen, please welcome Julie Lichtenberg.
Good morning. It's a pleasure to be here today. I feel like a real special guest as a registered nurse here talking to all my medical imaging heroes. I've learned to say medical imaging by working with Lori Schachner, who has taught me modality, medical imaging. It's not radiology. So what I'm here to talk to you today about is a blend of service excellence and rounding. So could I have a show of hands of who's been working on service excellence or have heard it in their hospital big time? A lot of what I'm using is Studer. Anybody working with Studer right now? Okay, this will be familiar to you, but it's digging a little bit deeper. And what I'm talking about is rounding for outcomes, leader to employee rounding. Not so much rounding on patients, but leader, so you'll be leading, talking to your employees. And it really is the #1 way to increase staff retention. It'll improve your operational efficiency. You'll be able to quickly respond to performance issues, machines breaking down, and you'll be more proactive than reactive. Do you find in the healthcare setting, because I've only worked in a hospital, but aren't we always reacting versus being proactive? And isn't it a beautiful day when you're proactive and you've got all your ducks in a row and something happens and you're all set for it? Or when whoever you report to said, you know, Julie, by the way, I want you to do this, and I'm like, already done. Isn't that just the most beautiful meeting in the world, instead of like, I'm in the car driving home from a meeting and I check in with my boss and she says, by the way, Friday I want you to present on something, and I'm like, oh my goodness, I don't even, now, you know, it's going to be like all night studying, getting a report ready. So leader to employee rounding will help you be proactive. The objectives for this presentation is I'm going to describe the pillars of excellence, and I'm going to talk to you about questions to ask yourself as leaders as you do your job. Identify pre-rounding, rounding, and post-rounding steps. Identify the direct benefits, the indirect benefits. Explain why you should do all the steps of rounding. And then I'm going to describe how. In my slides, you're going to see BP. That means best practice. I have worked, our corporation is like 10 to 13,000 employees. It's a big, big corporation. And I've led a corporate committee that has really drilled down on this whole process. And that was multidisciplinary. And so we have the whys and the hows. The pillars of excellence, people. Lori talked a lot about people. People are so important to your medical imaging department. And you can't expect great patient satisfaction if you have medium to low people working for you, medium to low, and physicians that aren't happy and expect great patient outcomes. There's such a huge link to that, those low performers. You really need to assist those low performers in helping them get out of your medical imaging department. And you don't really have to feel bad when you're getting rid of a low performer, because honestly, they've done it to themselves, haven't they? And who of you, don't you just really, like when Lori said that sign that had the 60% medium performers and 20% great performers, and you spend all your time, you know, with these low performers, and it just sucks the blood right out of you, doesn't it? And spend a little time with those Pollyanna high performers too. Praise them. You need them. They are your cheerleaders. When you're not there, you're hoping they're out there spreading the good word. You know, they are the ones that are going to also assist you as a director and a manager to move those middle performers to high performers. People are so important on these pillars of excellence. Happy, smart people. You may have somebody that's been working in your department for 20 years, and they feel entitled, don't they? Well, I've been here for so long. I can come in. I can bring my rotten attitude. I can challenge Lori with the change because this isn't going to work. It didn't work 10 years ago. And so maybe you've got somebody just out of radiology school, medical imaging school, an ultrasound tech, brand new ultrasound tech. And Lori tells me they're very hard to come by. Anybody having a hard time finding great ultrasound techs need them? Okay? And they may be such a great new addition to your department. But they're new. They've got a lot to learn. I always felt with nursing school, graduating from nursing school was my ticket to get into the hospital, and then the education really began. Anybody feel that way about medical imaging? Because you really learn by doing. But you're getting a great ticket by hiring happy, smart people. Because every day I'm learning something new. Every day, and I've worked in a hospital almost 30 years. I put over 25 on my speech just to make it sound like I'm a little bit younger. So people is so very, very important to these pillars. And then we get into the service, the great service that your happy, smart people are going to give. Because your departments make a lot of money for the hospital, don't they? And you can choose women where they want to get their mammography pretty much. They need an ultrasound. People walk in and out of your departments. They also come as inpatients as well. But when your medical imaging techs, they do safety well, they welcome you. What is your name?
Gary.
Gary, can I touch you?
Sure.
Okay, so Gary, you're coming into my department, and I'm walking you in. Hi, Gary. They already told me that Gary's the one with the blue shirt on. And so, Gary, it's time for your ultrasound. I'm going to take you in. And I'm going to look at your ID band that they put on, whether he's an inpatient, outpatient, whatever. I'm going to ask you your name and your date of birth. You're going to hear that a lot because for your safety, we're going to make sure that you're the one that's getting this test. So, we're doing this for your safety. I'm closing the door for your privacy. And I'm really grateful